Doctors are not God. What doctors can do is the best for the patient to the best of their ability with utmost honesty and integrity.
Patient first healthcare, how it should come across to the patient.
I think we have to keep the patient in the center of the circle. The patient is coming as a human being in stress. Patient is not a bed number. You have to think of patients first. They are the core soul of our existence. So we live because of them. The greatest message which I can give to any youngster who's joining medicine or pursuing medicine is treat the patient as your own. You will never go wrong.
In ISW also, we talk a lot about patient centricity, how you put the patient at the center of the care. Anything, whether digital integration or the medicine research or the care planning, or for that matter infrastructure creation, the hospital making, everything has to be created for the patient, the soul of the.
Yeah, so I think when as an administrator, when you're trying to create and build from scratch what we call as digital smart hospitals, it's about having a correct attitude, what your aim is, what your focus is, and you'll have ups and downs. And very often, I always say that 99% of things which happen in our life is according to the attitude we embrace for ourselves. Only 1% is because of the external situation. 99% is how we react to that situation. So I think in a path going forward, you have to be open-minded. You have to have your team in front of you. You have to think of your team. You have to think of patients first. They are the core soul of our existence. So we live because of them and not the other way around. So I think we have to put patient first. The patients are the stakeholders. They have to be a part of the decision-making cycle. So things like home care, ambulatory medicine, these are all things which are patient-centric. The newer avenues like robotic, intuitive surgery, stem cell surgery. Now, I think in the next 1 or 2 years, India will see regenerative medicine. These are things which will outpace all the old concepts. So I think medicine is evolving in an extremely fast pace. And we are fortunate that we are living in an era of such advanced technological advancement. So I think it's good for the patients and it's good for the medical system.
So I would like to, request you to decode two terms a little bit more or explain for our audience. Patient first healthcare. What all it should, how it should come across to the patient in terms of, multiple aspect, how they reach to healthcare, how they navigate the healthcare, how they come across to a doctor, all that, which is a lot of nuances and, a lot of those subtle aspects related to health, a lot of soft skilling of the healthcare professional, which can make a patient, feel more easy, more empowered, more, satisfied maybe from the outcomes or the process. And the other word which you mentioned about is smart hospital, how those smart hospitals really look like. Is it all about having those sci-fi hospitals where everything may be happening on gadgets? You may see more robots than the humans. Is that the smart hospital? So let us, talk more about patient first and then smart hospital.
Yeah, so first, describing patient first, when you say patient-centric care, or when you say our entire aim is based on evidence-based medicine for the patient, by the patient, I think we have to keep the patient in the center of the circle because they are a part of the decision-making cycle with us. And the core philosophy of being patient-centric is continuing of care. So the care doesn't actually begin and end in the hospital. The patient may be having an ongoing problem at home. So it includes how the patient is looked after at home. What is the need of hospitalization? What is the ease of comfort of shifting the patient to the hospital, either on an OPD basis or in a critical emergency? That includes ambulatory care. When the patient steps into the hospital, the patient is coming in stress. So I have always again stressed on the fact that there is no line apart from medicine which is more challenging, more physically, emotionally, mentally demanding and challenging. But the real issue is that you have to think of a patient as a soul. The patient is coming as a human being in stress. Patient is not a bed number. Patient is not a ward number. Patient is not a description of a disease. A patient comes to you in seeking help. And I think we have to reach out to the patient in that same aspect. How the patient is dealt with when he comes to or she comes to a reception, how the patient is guided to the outpatient department or indeed the process of admission. What is the comfort the staff can give to a patient during the course of being shifted to the room, or the explanations which are required by the paramedical staff and the medical staff of whether the patient requires surgery or some intervention or is going to be shifted to the ICU or the cath lab or for dialysis. There are so many moving parts. I think the patient's relatives, the family must be also kept in comfort and in full confidence. It's our duty to inform all medical details to the family. The transparency comes with that. You have to place the facts in front of them. Doctors are not God. What doctors can do is the best for the patient to the best of their ability with utmost honesty and integrity and utmost intellect. The ultimate healing is by God. We have to be a part of the cycle with the patient to give them as much comfort. We've seen a lot of patients who are in terminal stages. How do you give the patient and the families that kind of comfort? Patients also come with a lot of financial distress. Private healthcare in India, although is cheaper than in Western countries, but doesn't come cheap for a lot of families because the insurance cover is still low. So I think it's an overall dimension in which you have to give a patient, treat them as one of your own, and you'll never go wrong. The greatest message which I can give to any youngster who's joining medicine or pursuing medicine is treat the family member as your own family member. Treat the patient as your own. You will never go wrong.